Same time she had found a driver too.
Set. Janelle, we are ready to go. Request resolution number 1 to authorize contract amendment with Greater Adirondack Homeaids.
All right. This is an increased rate from $25.54 to $28 an hour, which is a 9.63% increase, or $2.46. Health services contracts with GAHA, and I put the resolutions there. To provide aid services to our patients. This rate was last increased in 2015. The requested rate increase is due to obviously the increased cost of providing services and New York State mandated minimum raise increase. And this is anticipated to be an additional impact of $590.
Supervisor Garrity, seconded by Supervisor Gerasi. Discussion. All those in favor?
Aye.
Aye. Opposed? Resolution number 2.
So this is,
go ahead.
I'm sorry, to authorize a contract agreement with Ability to increase the rate from $426.87 a month to $463.15 a month, which is an 8.5% increase, which is $36.28 a month, to increase for Medicare billing services. And this will be starting in March of 2023. I'm sorry, my fiscal person told me I think I have to make that February. So if I can make that change.
So that's cool. Great.
I'll move the motion.
Supervisor Garrity, a second by Supervisor Gerasi. Discussion. All those in favor?
Aye.
Opposed? Number 3.
Number 3 is to amend Resolution 230 of 2022 to include New York State licensed and/or certified professionals approved by the Commissioner of Education. This is for our Committee on Preschool Education Program, and we're in desperate need of providers. Initially, we had a resolution via the chair of the board to contract with schools. And we're just wanting to increase that to other providers that are approved by the state to provide preschool services. So these would be individuals that meet the criteria.
Fine. Can I get a motion to approve that? Supervisor Bramer, seconded by Supervisor Gerasi. Discussion. All those in favor?
Aye.
Opposed? Number 4.
And just one thing going back to that, that's non-competitive and it's the same rate for everybody. So it's the more people we have, the better it is. If you look in your packet that I gave you today, that's updated, it has the resolution number 4 that's been updated. We're looking for authorization for the chairman of the board of supervisors to enter any contract or amend prior contracts with the electronic medical provider for the electronic visit validation service, which is required to be in place by New York State. EVV, which is the electronic visit validation, is mandated to be in place by January for home care agencies billing Medicaid. We have about 6 clients on our rolls right now, and we're not exactly sure how to get a vendor, but we might be amending a contract or we might be setting up a separate contract, and we're just looking for that flexibility.
Can I get a motion to approve that? Supervisor Gerasi, seconded by Supervisor Garrity. Discussion. Yes, Supervisor Bramer.
I'm not seeing the number 4 attachment.
It's set really at the bottom. It's the last one, I think. But I've got it here, Claudia. If you could just like that.
I have an extra here. Sorry.
I have the thing you just gave us. This is for preschools and daycares.
The number 4 is for the EVV, the electronic visit validation.
Can you just show me? Otherwise,
you can have that. Maybe you should just swap out the packets because that might have been missing one. So just to provide further clarification for the EVV, it's when we do a visit with somebody that has Medicaid as their insurance, we have to show when our staff showed up and when our staff left, and when we bill for those services, we have to be able to show that documentation. So we're looking for a vendor to be able to match with our current vendor to be able to make that happen.
It's my understanding that there is a January 1st commencement date for the requirement that EVV goes into effect. It's also my understanding that you're requesting a 1-year contract beginning on the 1st with an annual renewal. Okay, thank you.
So we have a motion and a second on the floor. All those in favor?
Aye.
Opposed? Number 5.
Okay, to authorize filling the vacancy of a public health nurse number 10, which is a grade 22 with an annual salary of $62,310, which became vacant in September due to a resignation. This position is responsible for our mandated disease control program and is eligible for Article 6 state reimbursement.
Get a motion to put that on the floor, please. Supervisor DeRossi, second by Supervisor Garrity. Discussion. All those in favor?
Aye.
Opposed? Number
6.
what is that? Number 5.
Number 6 is to authorize an extension of our current 2022 intent to fill forms to authorize filling vacancies below. Tried to put a grid there for you so you could see what positions were available and what the date of vacancy was.
Can I get a motion? Go ahead.
No, go for it.
A motion to approve resolution number 6. Supervisor Breimer, seconded by Supervisor Garrity. Any discussion? All those in favor?
Aye.
Opposed? No. Number 7.
Number 7 is to request referral to Personnel Committee and fill vacant newly created positions in the 2022 budget. Again, I listed out those positions for you. Health Services created 5 positions above, 3 of those being full-time, 2 being part-time, and 2 of those being promotional in the 2023 budget. And we're looking for authorization to fill. During the budget process, Health Services restructured and eliminated 12 positions and created these positions, and at the end saved $505,318, which includes salary and fringe.
Resolution number 7. Can I have a motion to get it on the floor? Supervisor Garrity, seconded by Supervisor DeRossi. Discussion.
Just a quick question. Title says create a position in the 2022 budget. Is that supposed to be 23?
2023, thank you. It's hard, you're creating it in 2022.
But it's for next year.
So at the last, our last full board meeting, I think it was 2 Fridays ago, we did have the presentation with the chart showing all the health positions, and I was trying to figure it out as to what was going on. I don't have that piece of paper in front of me today, but you have the listing here of the 12 positions eliminated. Does that mean that they were actually deleted, or are they simply unfunded?
In my mind, I was thinking that they were deleted, but Tammy's got her hand up.
Tammy.
Yes, all but 1 were deleted, and then the last rendition of the budget officer's recommendation, he did have an additional unfunded position, and I don't have the chart in front of me, but most of the positions that so if she said there were 12, 11 of those were deleted, 1 was unfunded.
It was a nurse position. Initially, we had given up, correct me if I'm wrong, I think 3 or 4 CHA nurse positions, and then an additional CHA nurse position got added. So I can't remember if it was 4 or 5 because we went back and forth so many times, but one of the nurse positions is unfunded that we won't be filling. The others are gone.
How does that staffing compare to pre-COVID?
Well, I believe we had 14 home care nurses prior to COVID. We currently have 6 with, I believe, 3 open positions. You know, I think we've had to scale back as we've been looking at our referral numbers and things like that to a smaller business model. I think all the CHAs are focusing on the same thing. It's not only COVID, but it's also the new funding model of reimbursement from CMS. And the reimbursement where, you know, they're trying to limit people going back into the hospital. So they're now utilizing skilled nursing facilities more. So in general, besides losing staff and besides COVID, the health model's a little different. We're seeing people after they get home from skilled nursing if they still need help after rehab.
I just asked one more.
Okay.
On these ones that you're creating, are they revenue generating?
Some are, some aren't. So in public health, we got rid of one of our full-time nurse positions. Currently in public health, there are no full-time nurses working due to resignation. And I mean, going into budget, I had 4 full-time nurse positions that were vacant. I now have scaled that back to 2.5. And one of me giving up one of the nurse positions, I created a public health assistant position that's full-time and a public health program coordinator who are both non-nurses and paid less, because through the pandemic, we saw the value of using our public health assistants. And we're thinking maybe we could do that program cheaper by using like one nurse to supervise the unlicensed people doing the work. So it's not revenue generating, but it's working in a mandated program. The nurse position, I went from a full-time family health position to a part-time. Number one, hoping maybe I could find somebody that would be interested in part-time work since I can't find full-time people. But also, if that person sees family health, you know, clients, then there's the potential for billing for insurance there. The EI service coordinator, one of the positions I deleted was a 10-hour per diem position, and we created a 30-hour per diem position. So I put that it's promotional, but it's basically giving 20 more hours. With the pandemic, a lot of children didn't go to daycares. A lot of people didn't follow up with therapists because they were scared or they didn't want to, or they couldn't find therapists. So what we're seeing is a balloon in that program of special needs. So we're just trying to be prepared to be able to accommodate that surge. The Children with Special Healthcare Needs program Children with Special Healthcare Needs program administrator. That person is also promotional. That was a position that we deleted. It was in a program manager position. It was in the bargaining unit, and this one is outside. And we're looking at succession planning for the agency in addition to dealing with the surge. And this individual we're looking on to take some leadership responsibility to help groom for maybe future leadership positions in the county, in addition to take on a mountain of work.
Did you create a position behind them?
No.
You said you deleted their program manager. Is there something under them?
There's service coordinator positions.
Okay.
He was already kind of in a lead position through the pandemic and did a phenomenal job managing that group as the rest of us were dealing with.
The other thing too is we just got an increase in our Children's Special Health Care Needs grant, and they want half of a full-time person, and we chose him. So half of his salary is being covered by that grant now. That was effective October 1st.
Great, thank you. So we have a motion and a second on the floor. All those in favor?
Aye.
Aye, opposed? Nothing, nobody opposed.
All right.
Tawn,
Number 8, attachment is just transfers within our budget. The first is for bioterrorism program. It's related mainly to Dan Durkee because part of his salary does come out of that grant. And it has to be prorated with the increases that happened August 1st, and it wasn't. So we're just moving the money from where he is in the preventive program to the bioterrorism. So I just moved salaries and related fringe. The second one is again in our I guess Children's Special Healthcare Needs, again, same thing, that grant We have a part-time person or per diem person who's working in that. So just to get through to the end of the year, I need about $2,000 more in salary is what I'm guesstimating to get through the end of December. So that totals $8,895.46.
That,
Now, can I move 8, 9, and 10?
you certainly can.
8, 9, and 10 are all budget, right?
Yes.
Give a motion and a
8, 9, and
second.
10.
So
Well, 10 is the financials, but it's just giving, and sale is 11.
8 and 9 are budget amendments. 10 is a budget transfer.
did you want to move 8 and 9 or 8 and
That is just a transfer, right?
Yeah, it's a transfer. So 8, 9, 10.
8, 9?
I'll stick with 8, 9.
Second, we have a motion and a second, discussion. All those in favor? Opposed? And, 11.
Resolution request number 11 is to amend resolution 231 of 2022 to expand and include interested New York State registered preschools and daycares within Warren County. This would include agencies serving birth to 12th grade population in Warren County. Warren County received $1.7 million in a New York State ELC grant, and that funding was to provide initially COVID testing capacity to schools, which was later extended to COVID mitigation supplies for the K through 12 population. New York State has now lowered that age to birth to 12, so we'll be working with preschools and daycares.
Very good, thank you, Sue.
And then
Motion,
I'll make,
Supervisor Garrity, second by Supervisor Gerasi, discussion.
and that's a good thing. I mean,
It's given us more opportunity to spend
go
money,
to the, rather waiting the preschool,
right?
getting them, okay.
And we can work with Southern Adirondack Child Care Network to work with their registered programs.
Everyone feel comfortable? Supervisor Bramer.
This, the 1.7 million that we're getting from the state, that covers all of it.
It's 100% whatever we spend will go to that grant, so it will be no cost to the county.
Great.
Motion and a second, and all those in favor?
Aye.
Opposed? Passed. Any further discussion, Janelle?
Well, I know we're kind of running late, but there's a couple things that I just wanted to mention. The first is, and it was an attachment that was done electronically, as our community health improvement plan, which is a community health assessment. The attachment was electronic. If anybody wants a black and white version, be happy to print you one, just let us know. With this, we had a lot of collaborating agencies that I'm very grateful for. I just want to mention them. We had Warren County Office of the Aging, Social Services, our home health agency, community services. We also worked with Hudson Headwaters, Open Door Mission, the Waite House, and Supervisor Driscoll was a community member and brought a lot of expertise to that committee. For those that are not familiar with our community health assessment, every 2 years we have to look at all of our numbers, all of our data, and we put together a survey that goes out to stakeholders and to the community, and then that information is reviewed by the Community Health Improvement Committee or Community Health Assessment Committee. And then we pick 2 focus areas. We work with Glens Falls Hospital, which is also a collaborator with that. For the next 2 years, we're going to be focusing on priority area number 1 is preventing chronic disease. We're going to be working within the community to increase physical activity on tobacco prevention and chronic disease, preventive care and self-management. The second one is promoting well-being and to prevent mental and substance use disorders. One of those areas is going to be promoting well-being. The other is going to be working on mental and substance use disorders and prevention. And for that, we work a lot with Rob's group and people. So Dan Durkee, our public health program manager, has done an amazing job with this throughout the years. And there's a lot of good data in here and statistics. And I just want to express my appreciation for the Adirondack Rural Health Network, who helped us pull some of our numbers together. Our stakeholders that participated in the survey, in addition to community members, our Community Health Assessment Committee, and Dan Durkee for sharing all of his knowledge, expertise, and talent in getting this done. So if anybody has any questions, Dan knows our county backwards, forwards, and what all of our different rates are. So he's very passionate about that. And then finally, I just want to wish everybody a happy Thanksgiving and tell you how blessed I feel to be a part of Warren County and serving our community. And we're still working through COVID, and we'll be thankful, hopefully next year, that maybe we will be out of that program a little bit. But right now we're still getting funding. So.
Thank you very much, Janelle and Tara. Thank you. Thank you very much. Happy Thanksgiving. Privilege of the floor.
A tremendous amount of work goes into these reports. Thank you so much for all the work that goes into it, all that's provided. Just looking through it with all the graphs, and so well put together. I'll go home and read it and check up on it, but it doesn't go unnoticed. Thank you.
Yes.
Thank you, Commissioner. I myself, and I would say on the behalf of Warren County residents, along with my constituents of Queensbury, but really want to appreciate all of you and your whole department pulling us through this pandemic and seeing enough everything, the countless hours. So I am extending really. Hopefully, you can have a relaxing and enjoying Thanksgiving with your family, and look forward to you maybe spending a little more time at home with your family. But please extend it to your apartment. Our
absolutely. We have an amazing staff, and we're very blessed and thankful.
And that comes under great leadership.
Thank you.
I should say.
Thank you very much. Can I thank you? Thank you, ladies. Can I have a motion to adjourn? Let's see, second, Mr. President. Thank you very much. Happy Thanksgiving.